Before I turn to the remainder of the meeting over to our co-chairs, please allow me to thank each of you in advance for volunteering your time to this effort. You will find that the work that you will do provides meaning and value to our entire community. We all have moments in our lives in which we influence. We all have rare moments in our lives in which we have the opportunity to influence the well-being of others. Through your collective input, you will have positive impact on many. Our business community is depending on us to get it right as we prepare to re-engage socially and gradually reopen locked and shuttered businesses. At this time, I'm going to turn it over to Mr. George Argel, the president of Visit Orlando, our co-chair with Tim Giuliani, again, the president of the Economic Partnership.
George, please unmute yourself.
Thank you, Mayor Demings. Thank you so much also for your leadership in establishing this special task force. And with that, I now am going to conduct a roll call for our members present today, this morning. I'll be calling you by your affiliation and your name, and I want to make sure to ask that you unmute yourself to indicate if you're present, and then after doing so, please then mute yourself right afterward. Hope everybody has received those instructions. So if everybody's able to hear me, I'm going to go ahead and begin with Advent Health, Dr. Scott Brady.
Present.
Alphon Inn, Jesse Martinez. Jesse Martinez, are you present? Okay. Have you unmuted yourself? All right. Moving on. Black Business Investment Fund, Inez Long.
Present.
Career Source, Central Florida, Pamela Neighbors.
Present.
Central Florida Auto Dealers Association, Evelyn Cardenas. Evelyn Cardenas.
Present.
Moving on. Thank you. Church Street Entertainment, Doug Taylor.
Present.
City of Orlando and Orlando Venues, Alan Johnson.
Good morning. Good morning.
Darden Restaurants, Dave George. Dave George. Very well. Don Julio's Mexican Kitchen, Florencio Larry Rodriguez.
Present.
Dr. Phillips Center for the Performing Arts,
Good morning.
Kathy Ransberger.
Good morning.
Thank you. Florida Department of Health in Orange County, Dr. Raul Pino.
Present.
Highwoods Properties, Steve Garrity.
Present.
J. Henry's Barbershop, John Henry. John Henry. John Michael, Exquisite Weddings and Catering, Michael Thomas.
J. Henry present.
Johnny Rivers, Grill and Market, Johnny Rivers.
Present.
Great.
Can you hear me?
Yes, thank you. Kissimmee Osceola County Chamber of Commerce, John Newstreet.
Present.
Lake County Agency for Economic Prosperity, Brandon Metalka.
Present.
MC Spa and Nail Bar, Mary Chow.
Good morning.
Mosaic Hair Studio, Mike Vandelabille.
Present.
National Entrepreneur Center, Jerry Ross.
Present.
Nelson Mullins Broad and Cassell, Wayne Rich. Wayne Rich. Orange County Public Schools, Dr. Barbara Jenkins. Dr. Jenkins. Orlando City Soccer Club, Alex Lateo.
Present.
Orlando Health, Dr. George Rawls.
I'm sorry, this is Barbara Jenkins, present. I couldn't get my mute button.
Thank you, Dr. Jenkins. I was calling most recently Dr. George Rawls.
I'm present.
Health. Thank you. Orlando International Airport, Phil Brown. Phil Brown. Okay. Orlando Magic, Alex Martins.
This is Linda Lamon Gonzalez on behalf of Mr. Martin. Present.
All right. Thank you, Linda. Orlando Shakespeare Theater, Douglas Love Ramos.
Present.
A reminder that if you've already, if your name has not been called, please put yourself on mute.
Present.
Thank you. Prospera, Augusto Calabrese.
Present.
Rejoice in the Lord Ministries, African American Council of Christian Clergy, Pastor Roderick Zach.
Present.
Thank you. Rosen Shingle Creek, Dan Giordano. Rosen Shingle Creek, Dan Giordano. Again, there's a lot of background noise. If you're not, if your name hasn't been called, please place yourself. All right, moving forward.
I'm here, George. Good morning.
Oh, very good. Thank you, Dan.
Thank you.
SeaWorld Parks and Entertainment, Brad Gilmore. SeaWorld Parks and Entertainment, Brad Gilmore. Ready? Seminole County Government, Tricia Johnson.
Present.
The Mall at Millennia.
Brad Gilmore
Steve.
here.
Thank you, Brad. The Mall at Millennia, Steve Jameson.
Present.
The Trenton Santiago Group, Conrad Santiago.
Present.
The Vineyard Wine Bar and Healthy Bistro, Deborah Linden. Deborah Linden? Very well. Truist, Sandy Hostetler. Sandy Hostetler. UCF Rosen College of Hospitality Management, Dr. Yu-Cheng Wong. Dr. Wong. Very well. Unicorn National Development, Chuck Whittle.
Good morning, George. Chuck Liddell.
Universal Orlando, Rich Costales. Rich Costales. VMD Ventures, Harold Mills.
Present.
Walmart, Monicia Brown. Monicia Brown. The Walt Disney World Resort, Thomas Matzlin.
Good morning, George. Present.
Good morning, Tom. Wawa Incorporated, Todd Souders.
Present.
And finally, the YMCA of Central Florida, Dan Wilcox. Very well. Thank you, everyone, for your response. Again, to a reminder to keep you on mute until your position to be asked or speaking in. I'm now going to turn it over to my co-chair, Tim Giuliani, to take us through the public comment section of our agenda. Tim?
Thank you, George. At the beginning of each meeting, we will have a public comment section. And my understanding is that there are no public comments submitted, and I'd like to confirm that. Lucas, if you could.
That's correct. There have been no public comments submitted for this meeting since 5 o'clock last evening, which was the deadline.
Okay, thank you, Lucas. If you would like to submit a public comment virtually for the next meeting, please comment and by email at public.comment@ocfl.net before 5 p.m. the day before the next scheduled meeting. The Orange County staff will read your public comment into the record during the public comment portion of the meeting. Please note your email submission must have your full name, address, and phone number. Public comments that do not include all of the information will not be read into the record. Also, housekeeping, we've talked about the need to keep yourself on mute to reduce feedback and background noise, but also please do not put your phones on hold, as the music will be heard by everybody and will disrupt the call. Also, if you become disconnected during the call, make sure to go back to your email or calendar invitation and click the Join Meeting button. This will let you back into WebEx. If that doesn't work or you have other technical issues, Lucas Boyce is available at Orange County. His phone number is 407-257-2636. Should you have a technical issue, call Lucas. As a reminder, we're about to get into the Sunshine Law requirements for this group. I'd remind you, no texting. So do not text each other or the chairs at any time during the meeting, because it will fall under the public records Sunshine Law and will be made available to the entire group. So that's a reminder for this meeting. Also, for questions and answers, at the end of each presentation, we will hold a Q&A portion. So please hold your questions until that time to keep this as organized as possible. And utilize the group chat feature to submit your questions. That's how we will know. George and I will be monitoring. If you put your mouse over your screen, you should have a chat bubble, and there you can type in your question for the entire group to see, and George and I will facilitate a couple questions at the end of each presentation. So that will conclude the section, and I'll turn it back over to George for our first presentation of the meeting.
Thank you, Tim. That was a good summary of what we need to pay attention to. Let me now move to our first presentation in regard to what Tim was mentioning earlier, the Sunshine Law training. So with that, I'm going to turn it over to Catherine Latour, Assistant County Attorney for Orange County.
Good morning, everybody. Thank you for having me today. I'm going to see if I can start sharing my presentation next. Or Andrea, are you sharing my presentation? All right. Can everyone see my presentation?
I can.
Yes.
Yes.
Okay, great.
Yes.
This is the first time I'm doing this. Thank you for confirming. Okay, I'm going to go ahead and get started. All right. So I was asked to go over the basics of Sunshine Law and public records today. Even in the time of a pandemic, the Sunshine Law, or most of the requirements of the Sunshine Law, still need to be observed. The Sunshine Law is meant to provide a right of access to government proceedings, and this applies equally to boards like the Board of County Commissioners and advisory boards and task forces such as yours, when you are meeting to discuss issues and make recommendations that'll go back to the mayor and or the Board of County Commissioners for official action. And the general rule is that all meetings at which official actions are taken or public business is transacted or discussed shall be open and noticed to the public. And the Sunshine Law applies to any meeting between two or more members of the same board when discussing matters that may foreseeably come before that board. So what that means for this task force is that anytime you're having a meeting with another person on this task force and you're discussing task force business or any topic that could potentially become task force business, that meeting needs to happen within the parameters of the Sunshine Law. And a meeting can apply to a formal meeting such as this, but also to telephone calls and text messages, emails, or any sort of communication. So that's what Co-Chair Giuliani was referring to regarding text messages. You can't be privately texting one another on your cell phone or on the chat function, on the WebEx platform regarding board business, because all of that communication is supposed to happen in a way that is open to the public and subject to the requirements of the Sunshine Law. But when the Sunshine Law does apply, there are 3 general requirements. The meeting has to be noticed to the public, open to the public, and minutes must be recorded. Reasonable notice is what the law requires. There is not a certain number of days required by Florida law to notice a sunshine meeting. However, the county does have an administrative regulation that requires that an agenda be posted at least 5 days prior to an advisory board meeting. But generally, law just requires a reasonable notice. Now, usually when we talk about meetings being open to the public, we want these meetings to take place at a location that is easily accessible to the public, of a proper size to facilitate the interested public, and then entry to the public can't discriminate against certain people or restrict access to certain facets of the public. Right now, under Governor's executive order, this particular requirement of the Sunshine Law has been suspended temporarily until, I believe, the beginning of May. It may be extended. This is why we're allowed to have a completely virtual meeting without the public being physically present in the same location where the task force members are physically present. Currently, with the stay-at-home orders and the CDC guidelines, of course, this is impossible. Typically, also, when we're not operating in a pandemic, there must be a quorum of your task force physically present in the same room. Obviously, this is not happening right now, but as long as the executive order stays in place and active, we don't need to worry about a physical quorum. And finally, minutes must be taken of your meeting. You have a staff person listening in right now, taking general minutes of your meeting, just basically the main actions that are taken, topics of discussion. There's no requirement under the law that there be a verbatim transcript of the meeting, but audio is permitted to be taken of sunshine meetings, but it's not a requirement of the law. So your takeaway from this is that any discussions you're having with other task force members have to happen in the sunshine. If you need to have a discussion with someone else on the task force and it's not time for your next meeting, there are ways that we can accommodate that. I would recommend you reach out to county staff. If you needed to have a discussion, we just need to make sure it's noticed and open to the public. I think right now it would probably take place on the same WebEx platform. And so access is just how to access that meeting would just be made known to the public before it happens. There are penalties written into the law for violations of the Sunshine Law, both criminal and non-criminal. A knowing violation of the Sunshine Law would be considered a criminal violation. Accidental violations of the Sunshine Law are considered non-criminal, and the punishment includes fines, and for criminal violations, it is considered a misdemeanor of the second degree, punishable by fine or imprisonment. Just wanted you to be aware that there are penalties. Moving on to the Public Records Law, which is the sister law, so to speak, of the Sunshine Law, where the Sunshine Law provides a right of access to government proceedings. Public Records Law provides a right of access to government records. And every person in Florida has the right to inspect or copy a public record that is made or received in connection with the transaction of official business of any public body. There are a lot of exemptions to what is considered a public record written into the statutes. Only the statutes can provide exemptions to the Public Records Law. The county doesn't make up its own exemptions. Judges can't make up exemptions. So if there's ever a question regarding whether something is a public record, we look to the statute to see if there's an exemption. What is a public record? It's basically any material that's made or received by an agency in connection with the transaction of official business and used to perpetuate, communicate, or formalize knowledge. So any documents that you receive or that you create in connection with your task force work will very likely be considered a public record. And this is true regardless of the physical form of the record or how it was transmitted or received by you by email or a hard copy. It's equally a public record. Also, there's no exception to the public records laws for draft documents. So even if something is created but not quite yet finished, and there's a request for that document. If it falls under this definition of public record, it's going to be subject to disclosure. If you ever have any questions, whether something is a public record, if your documents are subject to a public records request, reach out to county staff and they'll very likely consult with the county attorney's office and help you respond to that request. There are also penalties for violations of the public records law, very similar to the Sunshine Law, both criminal and non-criminal. That concludes my presentation today. I know this isn't the best format for questions, but please feel free to reach out to the county attorney's office if any Sunshine Law issues or public records issues. If you have questions regarding either of those, we're here to help and to answer your questions.
George, I can't hear you.
I'd like to just momentarily acknowledge some members of the task force that wanted to be sure we had in the record who are present, but were not able to acknowledge their presence when I called their name. The names are Dan Wilcox with YMCA, Rich Costales, Universal Orlando, Monizy Brown, Walmart, Alan Johnson, City of Orlando, Orlando Venues, Jesse Martinez, the Alfond Inn, and also Dr. Wong from UCF Rosen College of Hospitality. And I believe that is it. Thank you. And now I'll turn it over to Tim Julian.
George, Deborah Linden also is present.
Very well, thank you. Okay, with no one else that we haven't acknowledged being present, I will now turn it over to Tim.
Okay. Thanks, George. And thank you for that presentation. We appreciate the guidance. So in order to meet the mayor's directive for this task force, obviously this is a health pandemic, and so we need a data-driven approach to our work. And to get us started and to start off on the right foot, we are certainly going to turn to our medical experts first. So I have the honor to introduce our healthcare partners. The first presentation we will hear will begin with Dr. Raul Pino, Director of the Florida Department of Health in Orange County. He will be followed by Dr. Scott Brady, who is the Senior Vice President of Ambulatory Services with Advent Health. And then next and finally, we'll hear from Dr. George Rawls, System Chief Quality Officer with Orlando Health. So at this time, I would like to turn it over to Dr. Pino.
Good morning. Let me see if I can share the image. Are you seeing the image that I'm trying to share?
Yes.
Yes.
Yes. Florida? Good. So, there's plenty of information and noises out there with regard to the pandemic. We would like to give you a brief update on what are the conditions in our county. As you probably have learned over the weeks that we have been doing this. Right now we have 1,235 individuals that have been diagnosed with the disease. We have 27 deaths, and we also, the range of age is from 0 to 101. The youngest individual that we have in the county was a 3-month-old baby. 50% of the individuals are male, about 48% are female. Blacks represent about 13% of all cases, white about 44% of all cases, and others about 25%. 28% of all cases are of Latino descent. The interesting part that I would like also to highlight with you is the fact that the pandemic has been a little bit different for us than has been for other counties. And I want to highlight that with this slide that I'm about to share with you. The system allows me, here it goes. Should be uploading soon. Okay, here it is. So this one is a more comprehensive view over the entire duration of the pandemic. And there you have the number of cases that has been reported per day on the top of your bars. Then you have all the ethnic distribution of the pandemic. And at some point, we can have you have access to all this information for future reference. And in the second block, the one in kind of brown, you have the number of cases, the test done every day, and the percentage of the cases that were positive. And I want to call your attention to this one. As you can see, we have seen a decline of the percentage of positive cases return that we are getting, even when the number of tests have continuously increased for the most part. And
Excuse me, Dr. Pino?
Yes.
I'm sorry. Would you mind enlarging that part of the document because it's not visible, it's too small on our screens?
Okay, let me see if I know how to do that.
On the bottom right, you might find a plus sign to...
Let me see. Let me move this screen. Yes, it is a plus sign.
Okay, there you go. I think that's much better.
That helps.
Much better.
You can see, I can go a little bit bigger. Let me see. So here, you will see that we have a decrease, a consistent decrease of the percentage of return positivity rate that we are getting even when we increase the number of tests. And I think this is a critical information, and it's one that we'll probably use as a gauge to see how our reintroduction of economic activity may affect the pandemic in one way or another one. But this is a good indicator because this is one that is not affected by the number of tests that we do. Others are that I'm going to show you in a second. Here in the bottom, you have two very interesting graphs. This is something that we monitor constantly for different situations. This system was developed after 9/11, and it is it's an early alert system that allows the health department to see what is happening in the ERs. So from the distance, we can see what type of cases are coming to the ER. Now, this is not diagnosis. It explores symptoms and signs. But symptoms and signs are a good indicator of what may be coming in. So we can explore different things. In the first one in blue, you have all admissions into our hospital day by day that cough was associated or described during the admission. Meaning everyone that was admitted here have a cough. Now, it could be any cough for any reason. It could be asthma, it could be allergies, or it could be COVID. But it gives you a good indicator of what's happening in the community, and you see how the graph varies day by day. But if you overlap that with the next graph or with the prior graph that I show you, you will see that they coincide with the high number of cases on that period. And it will coincide with the number of hospitalizations. The next graph on your the right to the blue one, you have in red fever, you have in blue cough, and you have in green shortness of breath. And this one doesn't measure hospitalization, this one measures ER visits. So any ER visit during those days that measure cough, fever, or shortness of breath is recorded by our system and is sent as an indicator. These are another measures that we can use to monitor the progress of the steps that you may decide to take, or we may decide to take, for the COVID-19 restarting of the economy. Let me see if I can share all the graph here with you. This can become challenging. Yes. Okay. Now, in another section here, and this is another element that we use to monitor our system performance. This is a dashboard that we built with the county for our emergency operations centers in the county. You have here a total array of information that allow us to keep track of what's happening. So to the left, the first column, you have the total number of tests conducted in the county, the total number of tests negative in the county, the total number of positive tests, the tests that were ordered from a hospital bed, that's what a hospitalization means, the number of deaths, then our bed capacity in blue, the number of beds that we have, the number of beds that we have available, the ventilators that we have in the county, how many are on site, how many are on use. The map, if you click the map, it will give you a view of each of the hospitals in the system and how they are performing on those same measured by hospital. And here you also have the daily cases and the age distribution. Something interesting in age distribution is the fact that it may be because our population is a little bit younger than other countries, is that most of our cases, we have been to our benefit with regard to poor health outcomes. Is more of our cases are between 25 and 64. And we know the disease is deadly for people who are 65 years and older with pre-existing conditions. On the other side, you also have the number of ICU beds, isolation beds, acute care beds, pediatric ICU, and also the total number of long-term beds that we have available in our county. Let me see if I can share the last info with you here. Let me see how, let me close here, okay? I'm here, and it will allow me to share it. It's coming, I'm sorry about the delay in the network. And next, I would like to share with you what we call, it's not, PowerPoint, here it is. So this is a famous curve. I'm gonna share with you the curve that we haven't shared with anyone yet. This graph is not pretty clean because I just did it before coming to the meeting. So this is how the curve of daily cases is behaving, and that correlates with every data that I show you. And this is the curve for epidemic and pandemic in the county. As we have expressed before, we think that we may have already have at least a peak. It doesn't mean that it's the only one, or I don't know how many we are going to have. I'm watching this over here. It has been a little increase, but those can be artificial. And why those can be artificial? Because this is based on how lab is reported. And if for some reason a lab may not report cases yesterday and report a bunch today, they have electronic issue, they have some interference, whatever the situation may be, we may get an artificial spike in the number of cases for that day. So that's why this graph is better look over time than in a day-by-day basis. And that's why we haven't either presented or discussed it much in public, because it can be misleading in some areas, but also give a false sense of hope that we already passed the pandemic, which we don't know for sure. And the last is for the number of cases that have died, what were the pre-existing conditions that are more common correlated to those cases in our country? Hypertension, 46% of all cases that die had a hypertension, diabetes, or chronic kidney disease. They have, some of them have cardiac disease. How that get classified is just a matter of semantic, but we can see the high blood pressure, heart disease, diabetes, and obesity are critical factors in pre-existing condition for poor health outcomes. With that, I will answer any questions that you may have now or later.
Thank you, Dr. Pino. As a reminder to everyone on the task force, there's a little chat bubble. If you put your mouse over the presentation, and you'll be able to type in your question, and then we can recognize you. At this time, Dr. Pino.
Tim?
Yes.
Just wanted to acknowledge that Phil Brown is on the call with the airport.
Okay. Thank you, Lucas.
Very well.
Dr. Pino, at this time, I do not see any questions. I'm sorry. I do see a question. Trying to sort through all of the comments. We have a question from Harold Mills, Dr. Pino. What are our plans for region-wide serological sampling and testing, and how fast can we affect that?
So the testing that we're doing right now, what is limiting is the supply chain of test kits. This is going to be at least monitoring a better way when we have testing at the point of care. And that's what we don't have, and we will not have in the near future because of the amount of test kits that will be needed. Also, another issue that we are confronting is the different type of tests that are out there. The reliability and fidelity of those tests is different for each test. But also, each lab is using a different platform. So it really, really complicates matters. For the IgM test that everyone is hoping that will have a role, it will have a role. IgM is what we use for HIV and other diseases. The question is that the test that we have so far, including the ABLU test that is going to be deployed, there are some issues with false positive and false negative, and it will be helpful. They will have a role, but not until they are all at the point of care. When we have to continue to do this type of testing that we are doing in the community, in a pandemic environment, that type of testing is very disruptive to the economy, to the population itself, and even to the health department. But it's the only way that we have to respond to the pandemic.
Thank you. Well, Dr. Pino, at this time, I do not see any questions, but I'm sure if you'll stand by as we complete the rest of the health presentations, I wouldn't be surprised if people submit more questions. With that said, from Advent Health, we're going to turn it over to Dr. Scott Brady.
Tim, real quickly, just want to acknowledge Monisha Brown with Walmart is on the call as well.
Yes, thank you.
Good morning, Tim. Good morning, everyone. My name is Scott Brady, and I have the honor of leading the Advent Health Pandemic Response Team. And for the last 8 weeks, we've met every day looking at everything from what goes on in inpatient and the outpatient world. Currently today, we have still over 100 inpatients with COVID throughout our hospital system in Central Florida, which extends from Flagler all the way to Polk County. We have seen a flattening over the last really 21 days. And so as we begin, many of our models, we're kind of showing the classic bell curve. But as it turns out, the bell curve has not been the curve that we've seen in Central Florida, but rather we've seen a flattening. We believe the social distancing is in large part responsible for that flattening in Central Florida. Because of the flattening, we are able to take care of all the COVID positive patients and the COVID suspected patients in our hospitals, in our progressive care units, in our ICU units, and with our ventilators, as Dr. Pino was referencing. So we're in good shape with that. We believe that the peak is more of a plateau. And in the last few days, we've seen a little bit of a softening, a decrease in that plateau. But I want everybody to understand we're not seeing a significant drop yet. We don't believe that we're going to have any future great spikes, and that's good news. But we're just seeing a couple, 1 or 2% decrease over the past 2 or 3 days. Really too early to call it being over the peak, but the peak is a plateau. We have in-house testing for COVID. We also have testing that we send to folks in Texas, where we can do up to 10,000 tests per day, the PCR test, which tests if you're actively infected. We have really ramped up testing in the community. And so for the past couple of weeks, we've tested in the Daytona International Speedway, at the Millennial Mall, and yesterday we opened up in Sanford. We're opening up tomorrow in Osceola at the Heritage Park, and Friday at Sumter College and Lake as well. What we're seeing in the community is when people come to be tested, of course, many of them are just fearful. Some of them have some of them have been exposed. We're seeing about a 1% positive rate of tests in the Daytona International Speedway area. We're seeing about a 2% positive test in the Millennial area. So pulling with what we're seeing in our hospitals, a little bit higher incidence throughout the probably South Orange, Osceola area, a little bit lower incidence in the Volusia, Flagler area. We are doing some antibody testing. We are hoping to do a lot more antibody testing in the next few weeks as we're getting that capability in-house. The antibody testing will be important to tell us whether our employees have had it and potentially could be immune, and also important to tell us how many people in the community have had it and just didn't know about it. They didn't have any symptoms or weren't tested. That's important because if it's a high number, and we're seeing some things in California and even in Miami, if that's a higher number than we have tested for and seen, then that would begin to decrease what we think the mortality rate is, and that's important. In our hospitals, we're working on plasma therapy. We have over 10 folks that have been treated with plasma therapy, and we're involved in several studies, including hydroxychloroquine, including other treatment things to help people get better, especially when they're in the ICU and not doing too well. So we are working together with our partners to try to give some good advice, and we'll talk about that a little bit further in our meeting about what we think our recommendations could be to getting back to work. Thank you, Tim.
Thank you, Dr. Brady. At this point, I don't see any questions. I will appreciate your time, and we look forward to your future comments. At this time, turn it to Dr. George Rawls from Orlando Health.
Good morning, everyone. How's the sound? Everybody hear me okay?
Sounds great.
Good, okay. So we are similarly looking at our numbers every day and watching a reassuring trend in lower numbers. And as Dr. Brady mentioned, that's correlating to what we're seeing in the community as well. So it correlates to the lower daily case counts we're seeing out of the four-county region. Our inpatient numbers for hospitalized COVID patients is dropping as well. So we have a number that looks like about 20 patients in-house right now, down from about 40 patients about 8 days ago. So slowly running down, following it very, very carefully, and we are updating those numbers 2 or 3 times a day to make sure that we're getting ahead of where we might have potential changes in direction. As far as testing goes, we are, like Advent Health, really ramping up our testing capacity. We are maintaining our testing capacity focused in on what we know is a significantly growing number of patients that are waiting to come back to the healthcare systems for care. And our tentative plan right now, which we're going to start to soft start this week, is to test all of our patients coming in for procedures. And that could be somewhere in the range of 7,000 to 8,000 patients, a month, grow up to 10,000 patients a month. We really want to maintain that testing pipeline for that group right now. We actually have continued to do the necessary surgeries, as most people know, and there's a lot of reasons for that, but probably the most important reason is patients need healthcare despite the COVID pandemic, and we have to be able to merge those needs with the needs during this pandemic response. So we've maintained a volume of cases, again, somewhere in the range of about 8,000 patients over the last few weeks that were all very necessary surgeries. And again, looking forward to trying to move that volume up for the benefit of the community. We have, for instance, in the queue right now, over 160 neurosurgical cases that are waiting to go to the OR. We have similar numbers like that across different specialties. So that's really where our focus on work is right now, is how do we get ourselves ready for that volume. That's going to include everything from testing patients, making sure we maintain a safe environment, to making sure that we actually have the OR capacity, that expanding our schedule, making sure we're reaching out to our community doctors. So again, we are reassured, cautiously optimistic, certainly not at all taking our eye off of the ball on the pandemic response. We know that, as Dr. Brady mentioned, this is going to be with us in a way that might not have been here several weeks ago, which we were envisioning an up and down type thing. This is really going to be sort of a slow up and a very, very slow trend down over time. We've got to find a way to live with this in the infectious disease backdrop in our community. I think we can do that.
Thank you, Dr. Rawls. At this time, I don't see any questions. Section on the agenda, which will provide more opportunity, but certainly on behalf of everyone on this task force, and I'm sure well beyond, we want to thank the three of you for your leadership and contributions to the community and to all of your colleagues. Certainly, this is very important work that you're doing, and we really appreciate the time you would spend with us to make sure we're informed.
Tim, we have one question from Chuck Whitehall for the doctor. Could the numbers also be going down because a large portion of the population may have already had this and we are developing herd immunity? And when I say a large portion, he clarifies, I say a large portion we knew never had it.
So I can take a hit about that first. We don't know the level of penetration that this has in the community, and this is where the IgM test, a good IgM test, is going to be very useful, because it will tell us the level of immunity that has been developed in the community. What is not known is how long that immunity could last. So that's why getting capability for testing rather quick is important at the same time, because some people are talking that this immunity could wear off in about 5 to 6 months. If it's not a permanent immunity, and again, not everything is known about this virus, if that immunity doesn't last as long as other DNA viruses, then RNA virus, then we will have an issue, because that immunity of the herd will not be built for a lasting period of time. And in that case, a vaccine would be the only very effective prevention.
Hey guys, this is Scott Brady. Herd immunity is when about 60% of the population has been infected and has developed an immune safety, an immune response in their body. That's very unlikely. We're only seeing about 1%, maybe 2% of the community that has been infected. When we do the antibody test, it's possible there will be more. Some of the studies that just came out of Santa Clara and even in Miami are showing that there is a percentage that has been silent. But even in that, it's probably more like 3 to 4%, maybe up to 6% of the community, but not near 60%. So we don't think herd immunity is even close at this time, which is important because that leaves a large percentage of our population still without any immunity to this virus until we get a vaccine.
Thank you both. Lucas, was that the only question that you had in front of you?
Yes, sir. And we just want to remind people that when you have a question, don't pose that question in the chat privately. Send that to everyone so that we may comply with Sunshine Law, Public Records Law.
Good. Thank you for the reminder, Lucas. So at this time, let me turn it back over to George Agell for our next presentation.
Thank you, Tim. Next, we're going to be on the agenda is on the federal guidance. And it's my pleasure to introduce Andrea Wesser-Bronner, Orange County's Chief Innovation and Emerging Technologies Officer. She'll provide us an overview on the federal guidelines on reopening business. So with that, my pleasure to turn it over to Andrea.
Thanks, George. I'll just briefly go through what was sent to the mayor from the White House for states, local governments, as well as tribal governments. And this is President Trump's Opening Up America Again guidelines. And the basic tagline or plan is that it gets executed at the local government level the state maintains the guidelines and then the federal government supports it. But make no mistake, it's pretty much driven by the governors, as you may have seen in the news. The governor can choose to implement it statewide or county specific based on some of the data that Dr. Pino showed. We'll show more about the gating criteria in a minute. It is a 3-phase plan, and you'll hear that trend throughout today's remaining presentations. The federal government has said that they recommend, again, around a gating criteria, we'll cover really quick, that each phase has a minimum 2-week rollout. And again, you'll see some of that incorporated into our plan. Now, the guidelines basically outline core state preparedness responsibilities that really focus on operational guidelines and themes in that sense, as opposed to economic recovery and some other themes. And they really want the states, and again, I think Dr. Pino showcased what our state's already doing in a number of these factions. So testing and contact tracing, in other words, where are symptomatic or actually diagnosed positively COVID-19 patients moving and where are they? They want to make sure that the state is sufficiently supplying protective personal equipment and other critical equipment. And again, we've already seen, even from our U.S. Trade Office that's local, really supporting that across the state. They want to ensure the ability to surge intensive care unit capacities with staffing, doctors, nurses, and medical aid. And then they want to make sure that the states are protecting employees in what we're calling essential throughout the state, and you've seen the executive order from the mayor and as well as the governor, but in what they're calling critical industries. And they're also ensuring that the state will support high-risk facilities, especially with elderly care, and then also having some prowess and stature in not just those workers who work for mass transit organizations, but also employees of the critical industries who are using mass transit. And then the last area is to obviously limit and mitigate rebounds and outbreaks, and again, the spikes that you've heard Dr. Pino speaking about earlier. So the gating criteria is very straightforward, and they basically have 2 buckets of how they're saying the gating criteria, and it's basically reliant on how much testing each state has the ability for. So they're either looking for a downward trajectory of the respiratory and influenza-like symptoms that have been reported within a 2-week or 14-day period, or for those states that actually have the capacity to test to actually see confirmed cases go down. And so again, the federal government is really enabling state and local governments through a base guideline recommendation. And this is a lot of the things that we've been hearing as best practices. We won't go through this here, but of course you'll have the slides so that you can see. Again, it's pretty consistent with both our executive order as well as the state. But the main phases are what's really important here. And again, you'll hear this as a trend today. So phase 1, and the government has set it up between 2 different, again, categories. One is for all employers, doesn't matter what type of industry. The second is for some specific industries. The first is, again, to encourage teleworking, again, for phase 1, whenever possible and feasible. And the way that these phases will work is that they launched this 6 days ago. They expected a 2-week window before you would even consider the 2 weeks of these actual phases. So as of 6 days ago, the federal government said, sorry, I'm getting an annotation request. So as of 6 days ago, the federal government is basically saying they would like all states to consider launching to the next phase in 28 days. So basically, we're looking at almost a month of teleworking still, or at least 3 weeks remaining. And then they'll have the states decide how you would return to work in phases. And then still closing common areas. Again, a lot of protocols that a lot of states and local governments are already putting in place. Minimizing non-essential travel still. And there are several guidelines with the CDC that I'll go over in a couple more slides. And then again, special accommodations for personnel who are considered the vulnerable population. And there's many different definitions around vulnerable. Part of that is elderly, part of that is compromised immune system. And then for the specific employers, as you can see here, I know we have a lot of members from those industries on this call, so we'll be speaking about this in a bit. But basically, it's organized by large mass population congregating types of industries. And so that's where the specific types of employers' guidelines are. Rolling into phase 2, a little bit less restriction. And again, what they're trying to look for is that gating criteria of 14 days, where either there hasn't been an uptick and an actual, perceived decrease in symptomatic COVID-like, so influenza-like respiratory symptoms, or actual COVID positive test cases. So they want to see that decrease. If a region or a state sees that gating criteria met twice over and no evidence of rebound is fairly clear, then they're saying you can move on to phase 2. And while phase 2 encourages telework for all types of industries and employers, in a nutshell, it's starting to slightly resume non-essential travel and the ability to think through, again, with state guidance, opening up some common areas and starting to get back to less people teleworking. And again, there's phase 2 specific type of employer guidelines as well. I think of note what would be important is that they recommend bars could operate, but with diminished standing room. And then the final phase, which is, again, meeting the same grading criteria I mentioned 3 times over, again, no evidence of rebound. So this will now be at a minimum 6 weeks of going through these phases. They're saying you can now resume all work sites to be open. They're recommending common areas to be completely open. They're recommending that essential travel can continue onward. And now it's more about, can those specified industries that are listed here essentially open and run at some capacity. Now, those were some very basic guidelines, but there are a lot of the specific agencies within the federal government that have more concrete and more detailed guidelines. And so from a health perspective, the Center for Disease Control is really the largest resource base for some very strong guidelines, especially for employers. And so here's just some of the very strong resources that they've provided for both the healthcare industry and, again, to help state and local and tribal governments put together these guidelines for all types of businesses. One of the ones that I thought was very useful is the communication materials. This will help you as an employer, and it comes straight from the top medical experts in the country in actually articulating social distancing and some other protocols. A couple other things worth mentioning is the Food and Drug Administration has put together an emergency use authorization capability, which enables new testing and diagnostic devices to support COVID-19 testing. The train.org is fantastic for surplus needs of the healthcare industry, as well as some very good training materials for our healthcare industry to look at best practices, again, around larger congregations of individuals. And then the community mitigation strategy is one of the strongest resources that the CDC has. This actually goes by industry classification. So again, where people largely congregate in mass volumes. So everything from churches to schools and daycares to elderly care facilities, nightclubs and bars. There's some really good, strong outlines there from the federal government. A couple other quick agencies that also had some good resources is OSHA from the Department of Labor. There's some excellent advice there, again, on social distancing, protective equipment for employees, et cetera. And there are even some YouTube videos from the White House that will show very quickly and easily and visually how to do some of these measures as well. Thank you.
Very well, Andrea. Thank you so much for that information. That's extremely helpful to everyone on this task force and all of our businesses. So with that, let me see if anyone would have any questions for Andrea on her presentation. Lucas, someone asked you to help me make sure I don't miss something. Go ahead.
George, can you hear me? This is
sir.
Jerry Deming. I wanted to just quickly ask Andrea, in terms of the phasing, you indicated that if we followed the recommendations, it would be a minimum of a 6-week period of time. And if you could kind of talk a little bit about whether these are guidelines or mandates for the state and how you kind of foresee this perhaps working within Florida.
Mayor, I'm sorry, we had a little bit of technical difficulties. Could you just, I'm sorry, I heard most of the question. Just repeat towards the end, sorry.
Okay, so this the repeat. As I view your presentation, these were guidelines, they were not mandates. But based on your research, how do you foresee this being implemented within Florida at this point?
Sure, so it's a great question. Again, since it's based on the governor's input, I actually did go on the calls yesterday. I'm sure other members of this team also heard in. And, you know, frankly, I think we're waiting to hear more on the operational side. What I heard yesterday, they really had Visit Florida presenting, and a lot of it had to do with marketing and the economic recovery part, which I think the federal guidelines don't really cover as much. But in a nutshell, you know, what we're hearing is there are some thoughts from specific industries, especially restaurants, hotels, and just greater tourism, that it sounds like the state's been pretty aggressively thinking through. So I think we'll hear that on Friday when they release their report. But again, as you could see, the balance, the federal guidelines from our government is not as fleshed out in those specific industries other than operationally, while I think economic recovery and some more details will be fleshed out and rolled out on Friday from the state.
And to the members of the task force, I thought that this would be very instructive to the work that we have before us, because we really have to understand the federal guidelines and mandates and what that looks like. And then we must understand the state guidelines or mandates and what that looks like in terms of how local governments would then take the various guidelines and create a system that works for us. And so this is really the purpose of this conversation at this point. And so I will turn it back over to our chairs at this point.
Thank you, Mayor. And again, thank you, Andrea. Did anyone have any questions for Andrea? Additional questions for her? And Lucas, if you can just help me make sure I don't miss somebody.
Yeah. I did see one question, George.
My question, this person, is in regards to keywords for distancing. There was no mention on number of individuals permitted in each phase. Strict, moderate, and limited distancing appears to be vague. So I need clarification on what social distancing means in a phase 1, 2, or 3 approach.
Yeah, it's a terrific question. So in all the research that I looked through, there hasn't been anything determined with numbers. Like I said, the closest or the best details to date is through the CDC, but even then, there hasn't been concrete documents that show that. Now, I do think there's separate documents for the healthcare industry that may have something in there. We'll take a look. But for the information that was provided to states, local, and tribal governments, no numbers.
Okay, very good. I hope that answered your question. Any other questions for Andrea?
Yes, we got one from Mike. It says, how are we going to communicate to the community what phase we are in?
Yeah, thanks. These are all great questions. So as we go through the Orange County approach, which Roseanne Harrington will be presenting next, I think we'll have a lot of those questions answered.
Correct. Any further questions for Andrea?
Good afternoon, Mayor, chairs, task force members. It's my pleasure to present Orange County's approach to reopening business. Next slide. So as we endeavor to create a plan, a phased approach to reopening business, there were a number of objectives that we kept in mind. Number one, as you heard the mayor mention, that we wanted to make sure we aligned with the efforts of President Trump and Governor DeSantis on the federal and state level. And we also wanted to make sure that we established clear guidelines for businesses and monitor compliance along the way. Most importantly, we want to make sure that we had a consistent implementation across all industries to make sure that there were no gaps, so that if you had an experience at a restaurant, your experience was similar at a larger venue or a dry cleaner, no gaps along the way. We also wanted to make sure that we monitored health data and used it in our decision-making process. This is really important. This needs to be data-driven decisions, as the mayor has mentioned. We also wanted to make sure that we complied with new federal and state regulations. So our approach to framework was that we wanted to look at things through an organization's ability to manage social distancing at all times. And that was a driving force in this framework. And we attempted to categorize by level of human interaction. Our approach is dependent upon availability of testing, as you heard Dr. Pino mention earlier. The availability of testing is crucial to the success of rolling out a phased approach to reopening business. And we wanted to make sure that we had task force input in categorizing these industries. One thing that we learned earlier along the way with executive orders is that there were a lot of industries that maybe were never mentioned or thought of, and so we thought if we had the 40+ members of this task force weigh in on how they thought we should categorize industries, it would be the best process. So now let me go over to our three-phased approach. As you can see, we have low human interaction, medium human interaction, and high human interaction. And what we've done here is, again, taken from much of the President's plan for the 2 weeks of operation and then monitoring. But what we did was we added a week of evaluation period after the 2 weeks to ensure that we captured any interaction or transmission that might have happened in that first week. As you heard Dr. Pino mention earlier, that many times it takes 2 weeks for symptoms to show up. And so we felt if we had that third week in there to evaluate the data, it would be more beneficial to us as a local community. At the end of that 3-week period, a decision would be made whether to move on to phase 2. And this could be, we evaluate the data, as you've heard all of the physicians mention earlier. Do we move ahead? We feel like we're still maintaining our momentum to decrease that curve, or do we pause, or is there a combination? There's been much talk about if you're doing well everywhere and there's one hot spot, how do you handle that? So as we move into phase 2, let's say you make the decision to move into phase 2, it's once again being open for 2 weeks, a week of analysis of the data, and the decision to move on to the third level. And then if, again, we can either move on, pause, or a combination of both and move on to the third level. Now, what we attempted to do here, you're probably trying to say, well, what falls into low, medium, and high? And that's what we need your help. I can just tell you, for example, what we thought a low human interaction is where, once again, a company can ensure social distancing at all times. And the volume, probably the volume of the interactions also. So you might say a low interaction would be organizations that can adapt well to social distancing, and maybe a dry cleaner, a salon, or maybe a restaurant that can really maintain the social distancing. Medium, we thought, would maybe be some of these venues where you have crowds of people. Again, it's the volumes. And then high, again, is most importantly, is probably theme parks and sporting events and large kind of activity where there's a lot of volume. So our working groups, based on this phased approach, we came up with a number of working groups that we are recommending, and this would be for task force involvement. So the first of which is, most importantly, guidelines for all businesses to reopen. And these are base guidelines for operations. We have heard from all businesses saying, please, can you help us have uniform guidelines that we can all adhere to? This, again, will ensure that we have no gaps. We entertain 75 million visitors in a year, and so the experience of not only of our own consumers, but of our guests is important. It has to be consistent across all industries. Next is the business readiness working group. And this is a group that will help businesses with their internal procedures. Do they have the supplies? If we're going to say that you need to have a facial covering if you were going to be within 6 feet of social distancing for employees and customers, do these businesses, particularly small businesses, have the supplies that they need? Do they have the internal procedures? Do they have the employee training in place before they open? Again, we don't want it. We're trying to help these small, medium businesses so that they can have a successful reentry. And then third, we have business compliance, which is very important. And we're anticipating that this group will have representation from law enforcement, both at the city and the sheriff's level, as well as the county attorney's office and other members. This is how do we ensure enforcement that, you know, every business has an input into how successful we are. And so we have to have a component of business compliant. How do we ensure that there's an adherence to our guidelines? Fourth is the health monitoring that you've heard the mayor talk about from the very beginning. This is a health crisis. We need to have a public-facing dashboard with much of the information that you saw Dr. Pino present that makes our consumers, our businesses, our visitors feel safe, that they have the information that they can see for themselves, the numbers. We also need to ensure the testing and the establishment of criteria to move to the next phase. This working group will be chaired by our healthcare providers and the Department of Health. And they will be responsible for coming up with this criteria of how do we ensure that we move to the next phase successfully. And last but not least is bringing back tourism. And we anticipated having Visit Orlando take the lead on this working group because this is the business they're in, that they could still have members of our task force involved, but that they would take the lead on that. I do want to, since I mentioned that we want to have the task force have input into how we categorize businesses. After the task force meeting, you will be sent 2 forms, one of which is to help categorize where you see each industry falling in the low, medium, or high human interaction category. And we'll give you some sample industries for your easy reference. And then also we will be sending you a interest indicator type of form, working group preference form, where you can list your preference of involvement on the working group. And we're going to ask you to rank that. And then we will take that information and start doing work group assignments in conjunction with the mayor. And with that, I think, one last slide. You're not alone in this journey. You will have a significant amount of staff support and subject matter experts at your disposal. And with the subcommittees, we're also hoping that you will include, you can invite any speakers that you want to speak at your working group meetings. You'll have staff support, subject matter experts, and then also there will be public comment at every one of the subcommittees. So for those who were not selected for the task force, there is an opportunity for you to weigh in and provide your thoughts. As you heard Andrea mention, we do have a number of resources available, case studies from the Economic Development Administration, from other countries, from other states that will be made available. And then one thing you heard throughout this conversation is public record and transparency. And so we're asking that all questions be directed to economicrecovery@ocfl.net. So if you have somebody send you a thought to your personal or your work email, we suggest that you direct them to the Economic Recovery email so that we can log their question. They're probably not the only one asking it, and we can give them a response. So with that, I'll entertain any questions.
Thank you, Roseanne. We have
one question from Harold Mills. Why would we need a consistent guideline? I'm sorry, let me start again. Why would we need consistent guidelines? Should we have guidelines based on the type of risk for each kind of business? low, medium, high, shouldn't a landscaper have different guidelines than the movie theater? So let me read that again.
I think I got the gist of his, and I think that, did that come from Dr. Rawls?
No, from Harold Mills.
Oh, from Harold. So Harold, what we're looking at, and that's a good teeing up to Dr. Brady and Dr. Ross, is that we're looking at base requirements for all industries so that when you walk in, you see employees with some kind of facial covering, you know that their sanitation, minimum sanitation has been met, that there's a process for social distancing. That's what we're looking for. What are those unifying, which you heard the president mention also. Now, it's not to say that, as I mentioned earlier, we are going to incorporate what comes out of the state, where they are looking at these special risk categories that will have more stringent requirements. And I think you're going to hear from the hospitals that they have to have the most stringent. So it's not saying that everybody complies and that's just it. It's saying we're coming up with the base requirements that each organization will need to build upon to ensure the safety of their employees and their customers.
Thank you, Roseanne. There's also a working group focused on guidelines for businesses. So I'm sure there will be discussion to get into some of these details that we're not able to get into with the full group. Any other questions? I'm not seeing any. Lucas, are you?
No, sir, I don't see any more at this time.
Okay, thank you. We'll, as Roseanne mentioned, we want to hear, I thought it'd be nice to hear from our hospitals who have, been quickly adapting with their environment and have some expertise and lessons learned to share. So I'm going to turn it over to Dr. Brady again from Advent to hear a little bit about what you've been doing in your hospitals.
Thank you, Tim. Andrea, do you have the slides behind this?
Dr. Brady, unfortunately, I don't have slides.
Okay, I can pull them up myself if I can take control of this.
Yeah, absolutely. Let us know if you need help getting a screen. Got it. Thank you.
Are you guys seeing this picture?
We can.
Yes.
Okay. So thank you very much, guys. For the past 2 weeks, Advent Health has been working on what does it mean to be a safe hospital for the next period of time, and what are our recommendations for businesses and the community to keep them safe. To begin with, I wanted just to set the stage. The pandemics come in waves. We all know 1918 and the first wave hit exactly when this was hitting, and the second wave hit in the fall, and it was much worse, and 195,000 Americans died in October alone. In 1957, the Asian flu came, a second wave came, and over 100,000 Americans died in the second wave. So pandemics come in waves. We know it will come in waves. We're just not sure how big of a wave and how can we prevent it or mitigate it. Some of this is being discussed by Advent Health and its partners. We look at one of the cities in China, one of the cities in South Africa and Israel, and we already see that even as their curve started to come down, they've had second waves. The good news is, at least in these 3 cities, the second waves are not as large as the first waves, but they have had second waves. So it's important to understand that there will be smaller waves or even larger waves as we go forward. We put together also a 3-tiered plan, and it was tried to make things simple. Today we're in tier 3, which is everybody is at home. Only essential businesses are open, and the doubling rates. We followed the doubling rates in the new COVID cases. Tier 1 would be after you have a vaccine or an effective treatment. That could come as soon as this summer if some of the treatments turn out to be successful, but it isn't there yet. But after we have an effective treatment, everything changes. Right now, we're saying we're going from tier 3 to tier 2. Some of the triggers in going from tier 3 to tier 2 would be, as the feds have said, a 14-day doubling, a 14-day new COVID case rate that's decreasing, or you could look at a doubling rate. You also want to look at the community hospital. Is the community hospital overwhelmed? Is there ventilators? Is there PPE? When those things work together, that there is capacity in the hospitals, there is PPE, and the doubling rates are decreasing, or the new cases are decreasing, you go into phase 2. What phase 2 looks like for us, we've drawn up phase 2. This is too small to see, and I'll get into the particulars in the next slide. But we've got level 1, level 2, and level 3 for the community, for businesses, and for hospitals. And I'm going to talk most in the next couple of minutes just about what does phase 2 look like. So what could be the next phase for the communities and hospitals and businesses as we see the 14-day new case rate and the doubling rate go down and capacity within our hospitals. Some of the highlights of phase 2, our recommendations would be that masks must be worn by everyone when outside the home. And so we are in Advent Health, I'll show you the next slide, but we are doing that with all of our patients, with all of the visitors, and with all of our employees. So 10 to 20% of the time, this virus is spread when you are asymptomatic or in the first 4 or 5 days. And it may be higher than 20%. Masks do a really, really great job, especially on the person who potentially is infected, of keeping the aerosol, of keeping the air, frankly, from their breath from going forward. So masks are a significant way to reduce transmission of the virus. In addition, if you don't have the virus, masks are significantly helpful in decreasing your ability to get the virus. And so many studies have done showing probably a 60% protection rate if you wear the masks. So we believe in this phase 2, which is somewhere between now and when everybody goes back to work because of a vaccine and because of a treatment plan, that masks are a very, very important component of keeping the disease from spreading to one another, keeping from a second wave from happening, and if it is, a very, very small second wave. When people do get symptoms, temperature testing is very important. They can get many symptoms. They can get coughing, they can get GI symptoms, but the number one symptom that people get when they get symptoms is fever. And so, as you know, we're testing in the hospitals for everybody coming in. Do you have a temperature, whether you're an employee or whether you're a guest? And we would recommend that when we go into phase 2, that in the community, our businesses do temperature testing, especially if there's going to be more than 10 or 20 people located in proximity to one another. In addition to temperature testing, social distancing needs to continue. Keeping people 6 feet apart has been very effective at tamping down this first wave, and that needs to continue. Now, that's not easy. That means in restaurants, tables need to be such that people can be 6 feet apart. In movie theaters, in churches, we're recommending that chairs in rows be taken out to have people stay 6 feet apart. This is also true of the waiting rooms in our urgent care centers, or in our physician offices, or in our hospitals, and we are remodeling them now so that social distancing can remain, in addition to dots on the floor to tell people to remain 6 feet apart. Those three are pieces of our plan that are very, very important, we believe, in any community efforts to move from a phase 1 or a phase 3 where we are now into a phase 2. Now, in addition to that, we need to be able to do or a staff. You only need the N95 if you're involved with somebody who is potentially has COVID or does have COVID. We're also adjusting visitation from the no visitors policy to allow a single visitor per guest, depending on our PPE availability. The third thing is to do the rapid turnaround PCR testing of all patients. We're in the process of testing every one of our thousands of inpatients with our PCR test. That PCR test will help us know whether they have active infection, because as you know, some of them don't display the classic infections, and we want to keep them safe, know who they are, and also we cohort those patients. So anybody who is COVID positive, and even after this test, who is COVID positive but not displaying symptoms, we already are cohorting them in our ICUs to where the rest of the folks who don't have that can remain safe, so that when you come to a hospital or an urgent care facility, you're going to know you're not going to be around people that are suspected to have COVID patients or that have tested COVID positive. In addition, we're doing PCR testing for COVID on 100% of our employees to get a baseline of who could be positive. We know that it's possible for people to be positive and not have symptoms, and we want to make sure we diagnose those, track those, and get them out of the workforce quickly and quarantine them so that they would not expose people. We're also working out processes to test anybody who would come into the hospital, be that outpatient surgeries, inpatient surgeries, elective surgeries, and all future patients. So we're trying to do everything possible with our masking, with our visitation, with our PCR testing to be a safe place for people to come. In addition to our facilities, and we're adjusting our facilities to maintain the 6-foot social distancing. Temperature checks, we've talked about those protocols, and then changing our environment to not only cohort COVID positive patients, but also cohort people that are just walking through the hospital, having them wear masks, making sure they're afebrile. We think if you do those things, not just in a hospital, but with employers, especially medium and large employers throughout the community, we're going to do a really good job of keeping these numbers from being elevated, along with the fact that we'll follow every day. What are the 14-day trends? What are the local hospitals doing in supplies and PPE and beds? And with that, we believe we can march through the next few months, awaiting and hoping for a vaccine and a treatment. And that's the end of our presentation. If there's any questions.
Thank you, Dr. Brady. I do not see a question yet. Lucas?
No questions at this time.
Okay, thank you. Thank you, Dr. Brady. At this time, we'll turn to Dr. Rawls from Orlando Health. Dr. Rawls, don't forget about the unmute button, please.
Hang on. You hear me now?
Yes, but let me, we're getting feedback, so if this time everyone can please make sure to place your phone or computer on mute, and we'll turn it over to Dr. Rawls.
How's that? Is that better?
Yes, sir.
Much better.
Okay, great. So similarly, we are looking from where we are now downrange and reflecting on the fact that we're leaving a scenario where there is a high degree of disruption to our lives and processes. And this is obviously not unique to us, but across the entire world. And then try to really just envision how we move into a state of acceptance and normalization of operations where we know that this will be, on our minds and part of what we have to account for. So certainly the approach, the phasing approach makes a lot of sense to us as well. What we're doing internally to make sure that we can manage the transition from where we are now to where we expect to be in 2 to 3 weeks when it comes to our operation is probably first and foremost is knowing our numbers, making sure that we are very, very accurate in what we are measuring, both internally and what we are learning from the measurements being done externally. We have our strategy team and our finance teams both completely focused on our internal measurements, and that's been extremely helpful for us. In fact, it was that team working together that got us our model in place that helped us project out things like our personal protective equipment utilization rates, our use rates for our hospital beds and so forth. And we're also highly focused on maintaining a safe environment. This has been true from the beginning of this scenario. It's really especially true now because we are entering a phase where we're going to be inviting patients back into our walls for the right reasons. And these are patients who have been waiting to come back to our institution of care. And just like every other organization and business in the community, that's really what we want. We want to get back to the point that we can get our customers, our community into our walls to provide the services to them that we are here for. That includes things like social distancing and physical distancing. That's not going to go away right away. Things like masks on all patients, masks on all team members, those are going to be standard in the next for the next several weeks. Enhanced screening, we have team member screenings that we are doing now and will continue to do. We're going to continue to do additional visitor and patient screenings to include every patient coming into the organization will get a COVID-19 test if they come in for a procedure. And if they're admitted to the hospital, obviously for a suspect COVID scenario, they're going to be tested. That could result in numbers over the next few months of somewhere, again, in the 10 to 15,000 tests per month range. And that's really where we want to maintain our testing focus. And the reason, again, is because that is the way we intend to, one of the measures we intend to have in place. Patient cohorting, as Dr. Brady mentioned, we're doing that as well. We want to make sure that when folks come back to the hospital for their care, that they know that we have a place and specific way to take care of COVID-19 patients. We've actually made use of several redeployed team members in areas where we have softer volumes. We're taking team members out of those areas and putting them into other roles that will support the safe environment approach. The other thing that we're really focused on is knowing our resources. We had stood up from the very beginning of this thing, two things that were important. One was a lab war room, essentially. I use the term war room because it looked like that. It was a command center for everything related to testing, as well as a supply chain group that functioned very much the same way. And that group's responsibility was to make sure that we were looking 5 or 6 steps downrange so that we didn't find ourselves surprised by anything that we might have encountered as best we could have controlled. And then finally, maintaining the high degree of quality that we want to have for our patients. It's interesting, the deferred healthcare piece, it's misleading when we look at our hospital volumes and our ER volumes, about half of what they would normally be. You would think, well, all the folks that came to our hospitals for care must not be sick anymore. It's actually not true. And as everybody I'm sure knows, those diseases still exist. The heart disease, lung diseases, all of those other complicated issues that patients have been under our care for are still there. In fact, many times those medical conditions are being deferred or ignored. They're not getting the care they need. So part of bringing our volumes back includes an awareness about making sure patients are ready for the care that they might need, whether it's chemotherapy, whether or not it's a surgical procedure, that they have the right type of support to be prepared for their procedures. That's the general approach that we've taken internally. And when we look out to the community and say, what can we do to support the return to some degree of normal operations, both socially and on the business side, what we want to do is make sure that we are there to support businesses in those type of decisions. And it's going to be, as we've heard, unique to the business. There are distinct differences in between the type of come back to normal plan you would have for let's say a landscaping business versus a restaurant. At the same time, both of those pathways have to be accounted for, and we want to make sure that we support those. In terms of things like hand hygiene, social distancing, use of masks, and so forth. Those are. I know the mayor is completely aware this is complicated from the public policy end, maintaining strict masking policy in the community, maintaining strict social distancing policies in the community for the long range, are a challenge. At the same time, I think they have to be considered. But we would always say, just keep in mind that some of these things, for instance, masking as an example, there are risks to that approach as well. People touching their face constantly, the notion that a mask by itself is as protective as, for instance, maintaining good hand hygiene can be misleading to folks. And we see that even with folks within the hospitals, that we have to intentionally go through the conversation with them about what is the actual best way to protect yourself from being sick. For instance, I work in the ER about 1 day a week, and even down when I'm working in the ED, I have to have that conversation with patients and some of our team members. Let's think about what it is that we have to do to stay safe. Keep your hands super clean, keep your hands away from your face, and make sure that you're aware of your contact, because that is one of the sort of hidden ways that people get sick with this, and it will continue to be an issue for us as we get back to our normal lives. Is everything you touch that you're not aware is possibly contaminated can become a risk. So those messages, I think, have to be balanced. But we certainly want to partner with our healthcare partners, our government partners, and certainly all of our private businesses to do what we can to support this effort moving forward.
Okay, thank you, Dr. Rawls. And appreciate the presentation. At this point, I'm not seeing any questions. Lucas, do you have any?
No, sir.
Okay. So at this time, I want to thank Dr. Brady, Dr. Rawls, Roseanne for your presentations and laying out a lot of information that we're going to need as we get into these work groups, particularly as we begin to think through some of the details to support the plan and how we can help businesses with supplies, how we're going to monitor the data and all of the metrics we need from a health perspective to be able to monitor the progress and the phases and potentially an emergence of a second wave. So there's so many details, of course, to be worked out through the working groups, but at this time we have a few minutes on the agenda for any discussion or any questions that anyone on the task force may have.
This is Chuck Whitall with Unicorp. I'd like to direct this toward the mayor and toward Roseanne. First of all, everybody did a great job. Thank you for having me part of this. We've got several hundred tenants who rent space from us. And we had a great discussion today, understanding kind of what everybody hears every day. But nobody understands when is the real date a tenant can open. Because it sounds like from this, it could be weeks and weeks and weeks. And I can tell you from what's in our portfolio, tenants are on the verge of going broke, all of them. Can't pay power bills, can't pay phone bills, can't pay water bills, forget rent. You know, none of them can pay rent. But they want to know when they can open. If I'm a small restaurant, what is the date I can open with these social distancing things? If I'm a bar, a small bar, when can I open? Hair salons, when can they open? They can respect 6 feet. When is that time frame? Because I understand all the medical part, but there was 5 times we spoke about medical people. Not one business person spoke until me now. But I can tell you from the daycares to the hair salons to the restaurants, and I don't care if it's a small restaurant or a big restaurant. We've got some of the biggest restaurants that rent from us. They are all weeks from going broke, not months, weeks from completely being broke.
Okay, let me just say, Chuck, thank you for your comments. The overall purpose of this task force is to focus on the business recovery efforts. However, in order to map out a strategy for reopening businesses from the small businesses to the mid-sized to the large ones, it does require having a body of knowledge and understanding the health-related consequences. Obviously, this is a pandemic that we're dealing with, so the reason why we all find ourselves in this situation is because of the health-related consequences. Reopening should occur at a pace that continues to protect your employees, protect those business owners, protect the consumers from the virus itself. The work of this task force is to make the types of informed decisions by which to make recommendations about when businesses can reopen, where there are specific dates that we will be able to phase in the reopening of businesses at various levels. Depending upon the type of business, depending upon the directives that come from the federal government, depending upon the directives guidance that comes from the state, we will then have to work within those particular frameworks to get it done. As you have seen, I can say that the state is working at a relatively fast pace with multiple meetings this week. We hope to have some type of document or guidance from the state. We cannot get in front of the various regulatory authorities in order to open up or give the appropriate guidance. So I believe that in terms of timeline, everyone wants to know when we can phase back in the business opening. So that is the role that each one of you have the opportunity to play. So do not take the role and the responsibility that each one of you have The overwhelming majority of individuals on this task force do represent businesses and the commerce here within our community. Our community does not respond just county by county. Our labor market is one that is more of a regional labor market. And so we have been very intentional about ensuring that the representation on this task force took into consideration the other input from the surrounding counties themselves, because we do and should look to have some consistency within our labor market about reopening the businesses. So that is why you have seen the kind of deliberate action that we have taken here. So I would urge you to, at the conclusion of this conference call today, this is just the beginning, but we're going to have to work at a pretty good pace in order to get the work done and meet the expectations of our business owners and our employees and the community at large. We're going to have to work at a fairly quick pace in order to provide the responses, Chuck, to the clients, the patrons, and the tenants of the various properties that you own or manage. So hopefully that provides some clarity to you. The goal today was not to make that decision today, but I hope that as the governor's task force provides additional information about the work that they've done, we will be able to take that, and within the next week to 10 days, we should be quite a ways down the road and being able to answer the types of questions you have asked with certain clarity. I hope that makes sense, what I just said to you.
It does, Mayor, and thank you very much. I'll be available 7 days a week, because I know, what I continually hear and what everybody wants to know is date. They're trying to figure out, are they going to survive or not? I had a tenant yesterday just say we're going to permanently close because they can't even project, are we going to open May 1st? Are we opening May 7th, June 25th? Nobody can even project a date. And I think we owe it, my part in this, to the public to figure that out so they can start getting prepared to be open and can plan at least for that time period. And I'm happy to start meetings this afternoon or tomorrow morning to get whatever information.
This is why we have taken two business leaders and the personalities of George Argell, who understands certainly part of our bread and butter here in this community, the tourism industry, but we were very deliberate in choosing Tim Giuliani, who looks across the various industries and spectrums here. So this is will be led by the business community itself. So we just say to all of you, we understand you've been patient at this point, but things have to be done, I think, strategically and at an appropriate period of time. And so we want to answer those questions. I think the worst thing that can happen is we open too quickly or open without appropriate sanitation protocols in place, and we find ourselves in just a matter of months seeing a resurgence, and that would be a major debacle at many levels, and we do not want that to happen in our community. So I hear from our business owners and everyone about the frustration that we are dealing with, but the reason you all have been selected, these are some of the best minds, the most intellectual minds that we have in this community, and I have no doubt that if we work together, we can come up with something that works for all of us. Okay?
All right.
Yes, thank you, Mayor.
Thank you, Mayor. Thank you, Chuck. We certainly have a sense of urgency here, and we also have a duty to get this right. So certainly appreciate your comments. I hear a lot of the same, and we will move as quickly as we can. Other question, asking from Conrad, can you give us a sense of availability of supplies in our area. So I'll assume that's sort of the PPE, that's the masks, and maybe even gloves. Maybe turn that to Dr. Rawls or Dr. Brady.
So supply, hey, this is Dr. Brady. Supplies continue to be an ongoing challenge. We do have enough supplies in Advent Health with gloves and PPEs, but this is going to be important for us to keep this on the forefront, especially for our business community, because they're going to need supplies, they're going to need masks, they're going to need thermometers, things like that. But today we have adequate supplies, but I will tell you that they are not abounding.
Thank you, Dr. Brady. And I think we have a work group that's going to be teed up to help to try to solve this and maybe work with some creative solutions to help businesses so that when there is a date of reopening, that we certainly have the supplies to make that happen, because we think that will be an important support that our businesses need. So hopefully many of you will participate on that working group. Also for the doctors on the call, I think a comment was made earlier about the effective ways to keep yourself from having the virus. And the question is, how effective is hand washing in keeping the spread of the virus from happening?
So this is Scott again. I mean, it's incredibly effective. If you touch the surfaces because someone has touched them with COVID and you don't touch your face, you're still fine. So along with the masks and the temperatures, having hand washing capabilities in each business all over the place is so important. The same thing we see in flu season.
Thank you, Dr. Brady. Another question for medical experts. Would you recommend cloth reusable masks to manage cost and supply issues?
This is George Rawls. Yeah, I think that we've learned it's absolutely effective and appropriate to use cloth masks. There's got to be some degree of attention paid to the fact that every mask is what we call fomite, which means something that can carry the virus. So as long as there's attention to keeping it clean, then that would be appropriate. In fact, we have those available for some of our team members in the hospital. We have many of the patients visiting the hospital that wear cloth masks, so there's no problem with cloth masks. And Dr. Brady, I don't know if you have a comment.
Yeah, I think cloth masks are going to be important for our community because not everybody can get surgical grade masks. Obviously, cloth masks are not resistant to water or for cough or droplets. So they wouldn't be preferred in an area like an ICU where there's high COVID risk. But we think for the community, that's going to be important to have that option.
Thank you. At this time, I don't see any more questions. Maybe Lucas, double check with you.
No, sir. We don't see any more questions.
Okay. Well, thank you. Thank you very much. I'll turn it back over to George Agell.
Great. Thank you, Tim. And thank you for the questions we received. And certainly special thanks to all of our presenters for the great job and information you shared with us. It's going to be very useful as we move forward with the next category of our process. I want to take the opportunity to make sure to remind the task force or share with the task force that our next task force meeting is scheduled for Tuesday, April 28th from 2:30 to 4 p.m. You'll be receiving a virtual meeting and WebEx instructions, each a member of the task force. There will be a weekly meeting calendar that will be forwarded to the task force prior to our next meeting. And again, following up on what you've been hearing, we'll also send the working group preference form to you for your review and completion. Now, please complete the form and email it to economicrecovery, as one word, at ocfl.net by Friday, April 24th at 12 noon. Hopefully everybody has that noted. Again, want to, in addition to our presenters, on behalf of Tim and myself, to thank the Orange County team for the incredible job they've done in organizing and the support they've provided to make this first task force meeting and future ones and in between those times successful. So our thanks go out to all of them. So at this time, it's my pleasure to reintroduce Mayor Demings to help us come to close.
Again, let me say thank you in advance to all of you for agreeing to spend some time with this. This is absolutely critical to our community preparing for our own future's economic vitality. as we move forward, I want you to be reassured that you will have staff here from within Orange County who will work with you to ensure that we get the work done of this task force in a timely manner. So in the coming days, after we understand your preference for willing to get engaged, those forms that we alluded to earlier are very, very important. We will then work with our chairs to begin to put some structure, additional meeting dates, and because we have the mandate of maintaining public records and meeting within the sunshine, we do want to be inclusive and receive input from the many different segments of our community who have been impacted by this particular virus. So we look forward to working with you in the next few weeks to drive something that is very, I think, attainable for our entire community. So again, thank you for your efforts, and thank you for indulging us today and going a little bit longer.
Thank you, Mayor. Thank you, everyone.
All right, this concludes the meeting today.
Everyone have a good day.
Thank you.
Thank you.